Teacher Syafika, and I will present about seizure disorders and epilepsy. Okay, so first we need to know the definition of seizure disorder and epilepsy. So seizure disorder is a temporary involuntary change of consciousness, behavior, motor activity, sensation, or automatic functioning. While for epilepsy, it is a chronic neurologic condition of recurrent seizures that occur with or without presence of other abnormalities. So we need to know how seizure occur and how frequent it occurs. So seizure start from or originated from epileptogenic focus or epileptogenic zone. Okay, this focus or this area is an excessive rate and hypersynchrony of discharge from a group of cerebral neurons that spreads to the adjoining cells. Okay, so we need to know the factors that cause the seizure, that triggered the seizure. So which are hypoglycemia, fever, trauma, hemorrhages, tumors, infections, and anosmia. And one of the factors also previous scarring, structural damage, or hormonal changes. So there are two major types of seizures, which are generalized and partial seizures. So under generalized seizure, there are five types, which are tonic-clonic, absent seizure, atypical seizure, and myoclonic seizure, and atonic seizure. So these generalized seizure occur at entire cerebral cortex, while for the partial seizure, it is occur at a single location, single focal area, and it includes complex and simple partial seizures. So when this partial seizure from one area, one focus point, and if it is spread to the adjoining cells and around entire cerebral cortex, so it will become mixed seizure disorder that soon become generalized seizure. I will share about the generalized seizures. So the tonic-clonic seizure occur at any age, and it involves excessive neuronal firing from both hemispheres in symmetrical pattern. And so the effect is it causes lost consciousness, both rigid or tonic, then will cause rhythmic clonic contractions of all extremities, and this long lasts to 5 minutes, and it has also postictal period for 1 to 2 hours, like such as where the child feel drowsy or in deep sleep. And for the absent seizure, it's not common in childhood and young adolescent. So the symptom is it will cause a momentary loss of awareness and motor activity, which exclude eye blinking, where it is like a focal area, and for example, eye blinking or rotating, and it is not more than 30 seconds, and it has no postical period like drowsy or others, and it is also often mistaken as daydreaming. Okay. While for myoclonic seizure, it is related to the muscle, so it related to contraction of single or small groups of muscle. While for the atypical absence, it is longer than absent seizure, where it is partially lost consciousness and occur not frequent. While for the kinetic seizure, it involves loss of muscle tone where the head, the drop head. So the partial seizures, there are two types for partial seizures, which are complex and simple partial seizures. So the complex partial seizures originated from temporal lobe, and it shows clinical signs, symptoms such as lip smacking, chewing, buttoning and unbuttoning of clothing. While for the simple partial seizures, it involves motor cortex and result in clonic activity of face of all extremities, and such as the effect from simple partial seizures, such as nighttime awakenings and twitching facial muscles. Twitching facial muscles that can interfere with speech and spreads to the hands. Okay, for the babies below 1 year, so infantile spasms can also occur. Normally begin at 6 months and disappear by 24 months. And early treatment with adrenocorticotropic hormone that can be administered. However, it has an impact on development, especially in intellectual impairment. So when the child has a seizure, it must undergo thorough evaluation to determine the factors that trigger the seizure. So the factors may be from family history, medical history, and developmental history that need to be complete, and EEG, which are electroencephalogram, to help determine the type of seizure. So the treatment ways to control seizure and epilepsy, it can be used anticonvulsant medicine and anti-epileptic therapies such as ketogenic diet, where it involves carefully monitored intake of sugar, fats and carbohydrates, where it makes body to force to use fat as energy instead of carbohydrates. And also surgical intervention has been the most successful treatment, where it can reduce the size and reduce the seizure focus of the brain. Okay, thank you for watching. Bye.